Hi and welcome to Bristle. I am Heather and I'm going to walk you through a use case for using the Bristle platform for a periodontal patient. So we have here John Bristle's oral health report card, and we're going to start on the first page and just navigating through the oral health insights and additional health and wellness insights along with some key bacterial species and the oral systemic health associations that he scored with. So we always start with looking at the beneficial bacteria, the gum inflammation, and the tooth decay bacteria. This specific case, we're worried about his periodontal concerns. He's presenting with periodontal disease, and we are using the test to decide whether we should do active treatment or if he's in remission. So as you can see here, the gum inflammation score is at 8 out of 10. So it is indicating that he's at high risk for periodontal issues and inflammatory responses. So this is where we start making some treatment decisions based on the bacterial load versus actually the presentation of whether there's inflammation actually present or not. You will notice as you're doing more testing that sometimes you'll have a high inflammatory load. However, there may not be presentation in the mouth. It's always best to start treatment prior to disease process progression. So clicking into his gum inflammation score, we can kind of evaluate what pathology is present in his specific oral microbiome and what's driving his inflammatory response. So within this category, you can open up all of the bacteria that are present and were detected. So as you can see, there's quite a few pathology listed, some in the Porphyromonas family, Provotella intermedia. There's some Enterobacter, Fusobacterium, and the Parvomonas micra, along with some other pathogens that are either low to moderate. So on this side here, these are the ones that are on the highest score that could be involved with some of the risk factors. With the platform, you can always open up each individual bacteria to learn more about each pathogen and how it can contribute to inflammatory response in periodontal disease. In this area also, you'll be able to find out more about the bacteria specifically. So, for instance, this Porphyromonas variety is a gram-negative rod that's anaerobic and it's sensitive to Lactobacillus rhodii. So I love using the platform to understand the bacteria that I am addressing, to understand what care I might want to implement for this patient. So feel free to explore each part of the platform. As you're exploring, everything is just a click away. We can talk about the bactericidins and how the bacteria in the probiotics help to mitigate the bacteria that we are trying to target. This green score or green circle also helps you understand how it lives within the mouth and what niches we may be looking for. So most of the bacteria that causes gum inflammation and periodontal disease tend to be anaerobic. Some are facultative in nature. So this talks about how it lives and in which niche it might live. So these live either within biofilms or in nooks and crevices where there is no oxygen present. This tells you about the bacteria itself. So it can kind of give you a hint whether it's a free-floating bacteria or if it's a bacteria that lives within a biofilm. And then this one will also tell you a little bit about the cell wall. Sometimes we use this biology to understand what might be actionable against this bacteria when it comes to medications or using antimicrobials. So coming back to his test score, you can go ahead and click into this section here where it says click here. In this area, you can actually pull up what he might be experiencing as far as symptoms, and it kind of can explain where these scores can be when it comes to the gum inflammation score or the corresponding presentation of disease as far as a clinical presentation. So he is high and experiencing some gum inflammation. So this will kind of give him some information as he's walking through the platform, readying him for the understanding that we do need to deal with some of these high inflammatory bacteria and do some treatment processes based on his oral microbiome inflammatory score. So just some supportive information for you there. All right, so we've established that he is presenting with periodontal disease issues and some inflammation, and he is positive with high inflammation bacteria. So at this point, he would be a good candidate to go ahead with some treatment based on his microbial score. So we also have some guidance when it comes to treatment planning through that process, and you can go ahead and click his coordinating presentation with periodontal disease. It will give you the score of his inflammation along with some in-office recommendations, adjuncts, his caries risk issue, and any home care recommendations and recare appointments. So in this, for in-office care, you may have the option to do a combination of antibiotics with metronidazole and amoxicillin. In this case, it is recommended at this time to avoid clindamycin due to clindamycin causing resistance with Porphyromonas gingivalis and AA. It has limited efficacy when it comes to the periodontal treatment, according to the research that we found. There are some adjunctive therapies in this as well, Perio trays, of course, implementing your scaling and root planing, possibly doing LANAP, or laser-assisted new attachment protocol. If you're in a more functional-based office, possibly doing some ozone insufflation or ozone trays and laser-assisted perio therapy. So you would implement your home care regimen as well. There is some great supportive information when it comes to home care and how to balance the oral microbiome. You will have the ability to access this information to help you support the home care routine. And John would also have the ability to go through and understand how his home care can change his outcome when it comes to the success of his treatment. So in his home care routine, we usually have a 2-phase process where we're doing some sort of weeding phase with an antimicrobial. We found that antimicrobials over the long term definitely cause a profound imbalance in the oral microbiome. So we usually just recommend doing an antimicrobial rinse for no longer than 2 weeks. The second phase of our care plans always involve doing some sort of oral probiotic and implementing a regular home care routine with brushing, flossing, tongue scraping, using a water flosser, and incorporating things like nitrate, arginine, and xylitol products to help balance the pH and the oral microbiome, feeding the good bacteria, promoting a healthier environment, and I call it the soil, or promoting a healthier garden for the good bacteria to thrive and take hold versus the ones that are causing the inflammatory response. So based on his oral microbiome testing, just on his gum inflammation score, he would be a good candidate to start some therapies to reduce his risk.